I was first diagnosed with hyperthyroidism in 2008 when I was in the Navy. I felt like I had the flu. I couldn't hold any food down and I felt exhausted. I went to sick call and at first the nurse thought that I just had the flu, but noticed the base of my neck was a little too large. She asked me, "Does your family have a history of thyroid problems?" I had no idea where a thyroid is or what it does, but after receiving blood work, her initial thoughts of hyperthyroidism was confirmed. Throughout my treatment, I learned that someone in my family history had Graves' disease and was triggered by stress. For the next few minutes, I will provide you with information about hyperthyroidism and Graves' disease. First, I will tell you what Graves is, what causes it, and how it is diagnosed. Next, I will inform you what some symptoms are of the disease. Finally, I will tell you about treatments that are available and what life is like for people after treatment. I will begin explaining what Graves' disease is, what causes it, and how it is diagnosed. Hyperthyroidism is a disorder of the endocrine system where the thyroid gland produces an excess amount of hormones. Graves' disease is the most common cause of hyperthyroidism. The thyroid is a butterfly-shaped gland at the base of the neck. It is responsible for secreting two hormones, T3 and T4. These hormones help the body control body temperature, metabolism, and keep other organs and tissues working properly. Graves is characterized by shaky hands, intolerance to heat, insatiable appetite, fatigue, and increase in anxiety. According to the Mayo Clinic, it may affect anyone, although it is more common in women and generally appears before age 40. Researchers and endocrinologists are still investigating the exact cause of the disease. It tends to run in family, therefore it may be hereditary. According to the American Thyroid Association, it is believed to be an autoimmune disorder. By using thyroid imaging techniques, doctors can precisely locate and measure the activity of the thyroid gland using thyroid uptake tests and MRI images. Graves' disease can be very simple to diagnose. Even though it can be easily diagnosed, patients may not know the symptoms experienced are directly related to Graves. If left untreated, it can be deadly. Diagnosis first begins with a visit to the doctor's office. Family medical history is questioned, physical tests are done, and blood work is taken. Blood work is taken to measure the amount of T3 and T4 and thyroid-stimulating hormone, TSH. An increase in these levels indicates an overactive thyroid. Another test is done to see if the patient is experiencing Graves' ophthalmology. Further testing is done to double-check these findings, which include a thyroid uptake test. This involves a trace amount of radioiodine being injected into the patient, and then a picture is taken with a special type of camera that measures the activity of the thyroid. If the doctor believes the patient is experiencing Graves' ophthalmology, further testing is needed. This includes going to an ophthalmologist. According to Mayo Clinic, it affects women more than men before the age of 40. Pregnancy increases the chances of hyperthyroidism, as well as smoking and excessive stress. The person has to be a genetic carrier for the disease for a stressful event to trigger Graves. Although Graves' disease is a form of hyperthyroidism, its cause is different than other forms. People can experience many symptoms of Graves, but may not realize all the symptoms are directly related to the disease. The symptoms of Graves' disease can range from mild to severe. The American Thyroid Association and Mayo Clinic list symptoms of Graves. The most obvious symptom is an excessive amount of T3, T4, and TSH. Again, these are only detected through blood work. The mild symptoms include an increase in anxiety. People often feel restless. An increase in irritability. People will often develop a short fuse. An increase in resting heartbeat, and if left untreated, this can result in an enlarged heart or develop more complicated heart issues. Graves' disease also has an increased metabolism. People will also lose weight. Patients with Graves also experience an insensitivity to heat. In my case, I would sweat more in hot weather, as well as be able to be comfortable in air-conditioned environments while other people were wearing winter coats. People may often have trouble swallowing food or may develop hoarseness in their voice. Shaky hands are a common symptom of Graves' disease. During the physical examinations, my doctor had me hold out my hands, and I could not stop shaking them. Symptoms of the eye disease are different. Bulging eyes. The eyes stick out of the head more than average. Dry, irritated eyes. Patients will often feel like there's a foreign object in their eyes, and double vision is the final symptom of Graves' ophthalmology. Now that you know a general idea what Graves is and what it looks like, I will explain treatment options for Graves. I will also talk about life after treatment. Graves cannot be prevented or cured, only treated. There are also treatments for the individual symptoms. The key for a healthy lifestyle with Graves is to recognize the symptoms, seek treatment, and follow the treatment plan set by your endocrinologist. According to the American Thyroid Association, there are 3 treatment options for Graves itself. The first, antithyroid drugs, are administered sometimes daily, sometimes twice daily. These drugs gradually suppress the production of the thyroid. The second, because the thyroid gland is the only organ in the body to use iodine, doctors will administer a dose of radioactive iodine, or I-131. Depending on the dosage of I-131, the thyroid gland will either be partly or completely killed off. If the patient chooses this option, they will need to replace the thyroid hormones normally produced naturally via daily pills. The third and least used is surgery. It's the least used because further complications of the surgery can result, including damage to the vocal cords and damage to other glands located next to your thyroid gland that controls the level of calcium in your blood. Treatment for the symptoms often include a beta blocker. Beta blockers do not affect the thyroid gland, but blocks the effects of the hormones on the body. Patients will experience a decrease in anxiety, heart rate, and have less hand tremors. Treatment for the Graves' ophthalmology includes eye drops or a lubricating gel placed under their eyelids at night. After a successful round of treatment, people can quickly return to their daily lives. The American Thyroid Association recommends the patient have blood work periodically throughout the year to measure the levels of replacement hormones, only if the person had I-131 or surgery as treatment. If the person requires thyroid hormone pills, the person will be required to take them every day for the rest of their life. For the past few minutes, I have provided you with information about Graves' disease. I explained how it cannot be prevented or cured, and how, if left untreated, it can lead to complications. I also explained the symptoms and treatment options for people with Graves. As for myself, I've been taking thyroid replacement hormones for almost 4 years. The pills are not a hindrance. I simply take them before bed. If I forget one day, I can simply take the pill I forgot to take the next day. I also go to my endocrinologist at least twice a year, and I get blood work done. The symptoms I experienced were shaky hands, high heart rate, anxiety, a short fuse, and an insensitivity to heat. I elected for the thyroid-suppressing medication first, but that failed to work. My doctor and I decided to take the dosage of I-131. After a month, I experienced hypothyroidism and began treatment for that, which are the thyroid hormone replacement pills. I am proud to say that I have a 5-month-old daughter, but my wife's grandmother had a thyroid disorder, and I have most likely passed the gene on to my daughter. The odds are my daughter will likely develop the disease as well. But there's a plus side. I know what the symptoms are, and she will be tested throughout her life to make sure we diagnose it quickly.